Most of us are pretty familiar with blood, but what actually makes up blood? A lot of it is white blood cells, red blood cells, and platelets. They make up about 40% of the blood. The rest, 55 to 60%, is plasma. Plasma is a straw-colored fluid comprised mostly, about 91%, of water and the plasma proteins. Albumin is one of the plasma proteins, and it helps maintain osmotic pressure. There are also multiple clotting factors: globulin, fibrinogen, and prothrombin. Because this is a fluids course, we're concerned with blood transfusions. We often give saline or something similar to support circulation in emergencies, but of course saline doesn't replace blood. So when we give blood transfusions, what are we actually giving? The PRBCs, or packed red blood cells, are most common, and they're used to restore oxygen carrying capacity. The fresh frozen plasma, or FFP, is given to restore proteins and clotting factors in order to improve clotting function, for example, to reverse the effect of warfarin. And the platelets are used to restore clotting function whenever disabled platelets are the cause, so for example, to reverse aspirin or Plavix. When we initiate and run a blood transfusion, we always need to be aware of the transfusion reactions. You could probably add dyspnea and hives to this list. In any case, monitoring of the patient's pulse, blood pressure, temperature, and respiratory rate will help you to make sure that you notice any reactions. Treatment is usually concerned with discontinuing the transfusion, although subsequent care may be required to deal with any persistent symptoms. Alright, that about wraps up the study session. We talked about the characteristics and roles of fluids in the body, fluid balance, tonicity, osmosis, passive and active transport and facilitated diffusion, fluid equilibrium. We talked about the role of renin-angiotensin-aldosterone system, acids and bases, and we touched on blood as a fluid replacement. If you have any comments or questions, don't hesitate to reach out or leave a note in the comment section, and please, if you find the sessions helpful, leave us a review so that we know. I hope you got something out of this session, and I look forward to seeing you for the next one.